meeting to order. Jenny, you want to go?
Rubing,
Here.
Marcus,
Here.
Roloff,
Here.
Hankins,
Here.
Kuntz,
Here.
Calorito,
Here.
Brown.
Here.
Okay, the next thing on our page here is the election for officers. So I hope everybody's been thinking really hard about this and come up with somebody that you'd like to sit in this chair for the next year. And Scott, I'm going to nominate you.
I'll second that.
Anybody else have any? Okay. I think you have to have a roll call.
Rubing,
Yes.
Marcus,
Yes.
Roloff,
Yes.
Hankins,
Yes.
Kuntz,
No.
Calorito,
Yes.
Brown.
Yes.
Motion passed.
Okay, and the next one, I will nominate Matt Kuntz from Emmett County. Do I have a second on that?
I'll second that.
I'd like to nominate Jairus Rubin.
Second that.
I'm sorry, who was the second?
Christian
Oh,
Marcus.
thank you.
Okay. Let's call it, we have two running. Okay, all in favor, so Matt's,
Okay, Matt, Rubing,
What are we doing?
this is for Matt's nomination.
Usually if you have two, you go around and you say Rubing or Kuntz.
Okay.
That just makes it simple.
oh, makes it simpler.
Yeah.
Well, okay, it's the first time I sat up here in this. Sorry. Okay,
Okay, so, Rubing,
Rubing,
Marcus,
Rubin.
Roloff,
Kuntz,
Hankins,
Rubin.
Kuntz,
Good.
Calorito,
Rubin.
Brown.
Rubin.
Passes Rubing.
okay, I think I'm supposed to get my seat up right now, or you want me to continue a little bit or what?
You want to move or are we good where we're at?
Well, I'll get my seat up. What do you want to do, Scott?
It doesn't matter.
It doesn't
to me,
matter,
really.
no, so-
We can conduct
We're
business
small.
from here.
Okay,
I do think, because this is our organizational meeting, I think we need to elect all three positions, which would include then our secretary. So are there any nominations?
I'll nominate Calorito.
Okay, are there any other? Well, is there a second for that?
Second.
Thank you, Bruce. Are there any other nominations for the position of secretary? Going once. Hearing none. Jennifer, can we have a roll call, please?
Marcus,
Yes.
Roloff,
yes,
Hankins,
Yes.
Kuntz,
Yes.
Calorito,
Yes.
Brown,
Yes.
Rubing,
Yes.
Marcus.
Yes.
All right.
Is that all of our officers or?
I think that is all the officers that are called for in our current bylaws. It says the Board of Health will have the following officers: chairperson, vice chair, and a secretary / treasurer. So you get two jobs, Rob.
Right. Right.
Okay.
And our CFO basically does the treasurer.
Okay. Now, we also, it's not on our agenda. But I think it's appropriate, since we're doing officers at this time, that we fill the committee spot that was vacated by Antrim County. And I believe Ms. Barty was part of the The budget, the budget committee, is that the personnel and finance committee?
Yes.
I'm going to suggest that, and I don't know if we need a roll call vote or how we need to fill that position. But I think since Mr. Marcus is here, I would nominate him to be put into that position.
Comment before you do that. I think you know the time, because that's a very important factor in the policy, and I need to be able to do it. So when is it something that's currently scheduled, something that could be changed, when the meeting dates are, because if I can't meet those obligations, I'm not doing it justice.
They are typically on the 15th of the month at 9 a.m.
And it's usually a phone, we're still doing phone,
We can do phone or, yeah.
we were doing a phone, it's approval of bills is basically what it is. It's about a 10 to 15 minute obligation. Zoom
Well, the
call.
time doesn't matter, how long it takes, so long as I can make it last for an hour, but I just want to make sure that I don't miss those meetings, and that's what's most important. So,
Does that work for you on the 15th at 9 a.m.? If that's, now, I don't know if there's flexibility among,
9 a.m. doesn't work for me because I'm a working person. I work for a living. And I don't sit at home. I have to, I guess if I'm the chair of that committee, I can change it, right?
I don't think there's, it's not spelled out in our existing bylaws when that specific committee is to meet, so.
Yes, if it's not written out, then I can.
They said, that's board of us on that committee.
Yeah.
And I was the finance officer on that committee,
You're the chair.
the chair. And we always had the young lady that was the finance director. She always attended those meetings too. And we, since the Zoom went in, we would receive it over your iPad, go through everything, so. And then on your last page, I do believe one of these things that has this month.
What is it that you're looking for,
The,
Sherry?
I found it. Oh. On the agenda on the back page, it has the finance committee accounts payable. We'll tell you exactly what we do. And today too, I will make a motion.
You mentioned some of our personnel as well.
Right, that's the
Separate
same
committee.
committee.
It's the same committee, so
Right.
too.
Personnel and finance committee
It's
is all one.
Is there the ability to do the meeting a half hour prior to the board meeting every month and have the minutes prepared?
The problem is the bill pay timing.
I
So,
got you.
Yeah,
So that's why it's been generally a Zoom call or just a quick Zoom call, because you get the bills usually a day or two in advance to review.
Is that spelled out in our bylaws when I get them?
I don't think there is, but there's always been enough time to review that it's a checkbook ledger, the employee expenses, mileage, reimbursements. If there's any questions, usually it's a short meeting.
Okay,
So
I don't think it'd be a problem, yeah.
I
I just want to make sure that.
think you do it from.
I didn't say yes just because.
I do it from the cab of my truck usually on my phone.
Okay,
as well,
so let's do this. If Mr. Marcus is willing to serve on that committee and there's an issue, can the committee agree to work out an alternate time before the 15th so that it doesn't affect the payment of the bills? Is that good with everybody? Who are the current members? I know it's Rob, Shirley. And who else is currently on that committee?
Well, let's
it
Charlie.
was Charlie.
It's Charlie and Karen.
Okay,
Okay, and then
And then it was-
Mr. Charlie no longer here.
correct.
I'm still trying to keep up with who's who.
Right, he's not.
We're supposed to have one from each county, is that correct?
Yes.
Okay.
Okay,
I don't think Mr. McGinnis's resignation has been accepted.
but he's not in attendance today.
Another point of clarification, Mr. Chair. So Mr. Marcus assumed that he would be assuming the chair role in this committee, and I think Mrs. Roloff holds that appointment at the moment.
Right, I think you would be.
Yeah, just a member.
member of
Yeah,
the
okay.
committee.
I was
Sure,
kind of
would still
referring to him
be-
as chair when I said that,
Yes,
so
okay.
they misunderstood me.
That's fine. So, it was proposed by me, that Mr. Marcus fill the vacant spot, for Ms. Bargy on the Personnel and Finance Committee. I don't know, Jen, if we need a roll call vote on that as well. And if we do, we probably need a second for that motion or
I'll
other.
second that.
Okay, seconded by Valerita. Are there any other? Well, actually, that would be the only, yeah, okay. So, let's do a roll call on that, Jen.
Rubing,
Yes.
Marcus,
Yes.
Roloff,
Yes,
Jenkins,
Yes.
Coons,
Yes.
Valerito,
Yes.
Brown.
Yes.
Still.
Mr. Chair, before we move on the agenda, I just had one more point of clarification. Wanted to clarify the process of appointing alternates to the meeting. I know we have a process in bylaws. I was just curious what the process is of the county's follow.
Regarding Mr. Brown's attendance?
Yeah,
Talk about-
yep.
Mr. Brown has been appointed by our chairman at the beginning of 2021 at the new seating in the Board of Commissioners. So he has been our health board alternate
Okay.
appointed
During the regular appointment process.
during the normal county appointment process. Every committee has an alternate appointment.
And I think we should point out too that while we're happy to have the opportunity to meet Mr. Brown, the reason that he's here is that Julie's still having some difficulty as a
Right.
result of the fire, and our thoughts and prayers are with her and her husband.
Yeah, I know it's in the
That situation.
bylaws. Just one curious about the process. Emmett County's going to probably have to go through a similar process. Just wanted-
Yes,
Thank you.
Mr.
absolutely.
Mr. Chair, no, we
Ma'am.
have to have one from Emmett County.
Well,
We have to have four, one from each county.
we do.
And you got Matt
But they
there,
have-
now whether he can work into
So
that.
are you suggesting that Matt would be on both boards? Because he's currently on the Program and Evaluation Committee with me working on bylaw revision. So he would be, if he were on, if Matt becomes our sole Emmett County representative, then I would agree with you, he can be on both boards. But
I think it would be appropriate to have, right now, we still have two representatives from Emmett County, one is absent today. So I think it would be appropriate to wait for that appointment until we
Until his
accept the
resignation is
from-
accepted.
From our.
Okay,
Oh,
so I think we'll, Ian, I agree with you, Matt, that, yeah, it makes sense to me.
I hate to appoint somebody without, well, somebody else.
Well, let's not put the cart before the horse. Okay, all right. Valid point though, Shirley, thank you. Next on our agenda, unless there's any other business regarding open spots. I'm not aware of any. Next up on our agenda is review and approval of the meeting minutes from January 14th, 2024. I would note, although I attended via Zoom, I was not here in person. Mr. Graves was my alternate. And I would note that when it says members in attendance, roll call, I'm sure you copied and pasted Jen, but I wasn't here. So I would move
Oh,
to
geez, I'm
remove me
sorry.
there, and also for the approval of the agenda, where it says all yays, again, my last name is listed and I wasn't present.
Correct. Thank
So
you,
if we
Jeff.
can make those two corrections, that darn copy and paste gets you every time.
It does.
I know.
It's funny.
I think you're allowed to be considered president and a member, but you just can't vote. So you can still, because you were on Zoom, right? Because that's how we do
Well,
it. You
that's-
are president, but you just can't
That's true,
vote.
right, I didn't participate in the
So
meeting,
you-
so
Well, we had an alternative representation for you at the meeting.
Oh, you did.
correct, yeah, we had Bob Graves and he is listed
If he
there,
was
so,
here and voting, then,
yes.
we can't have two representatives.
I would just, I'm fine with removing my name, yeah, no, that's fine. Any other corrections to the January 14th minutes? Hearing none, I will take the motion to approve those minutes.
I'll make the motion to approve the minutes as presented, as amended.
As amended. Been moved by Mr. Pallerito and seconded by Mr. Coontz. All in favor, say aye.
Aye.
Any opposed? Okay, item number 5. Review and approval of the agenda.
I move to approve the agenda as written.
Been moved by Mr. Coontz. Is there a second?
A second.
We have that presented.
Seconded by Ms. Roloff. Is there any discussion regarding the agenda?
The last item down there is a person here.
Item number 10 is Ms. Mary Moore present.
No, she's not. She called me today. She had a family emergency. She is not able to be here today.
Okay,
So we will have-
can we remove then item number 10 from our agenda?
I don't think there's any need to.
Oh, yeah, we
Just
did let him
change
do his own
the
update.
If she's not here.
I'll be happy to provide you with an update.
I think we should keep it, since the actual guy's here, we let him do the work, horse's mouth, right?
Well, then we need to amend the agenda to be.
I agree.
I'm in public comment, so I'll be happy to wait.
So,
Ian Murphy is instead of.
Ian
instead of
Murphy.
Mary Moore.
Are you moving that we amend the agenda?
Yeah, change the presenter
make that
from
motion?
Ian Murphy.
Could you make that motion?
Yes, I'll make that motion to.
I
change
don't
the
want
name.
to, hold on.
He said he didn't.
I don't want to preempt Mary. She does have, just found out that she was going to be presenting tonight. She does have a family emergency, so it would be proper have her come back.
Fair enough.
we'd have to,
Because I'm biased in what I'm going to present to you. She is a Stanford attorney, and her weight is going to be much more than my bias.
okay, so,
There's a motion.
I withdraw my motion because he's going to use it for public comment. Thank you.
Okay.
Thank you, sorry.
so
Appreciate
Mr.
that.
Murphy will participate during public comment. Is there any, did we have a motion to approve the agenda?
We did, yes.
We had a motion by Mr. Coontz,
Yep, seconded by Mr. Joel.
seconded by Mrs. Roloff. Is there any further discussion?
I think I would like to add rules to the Board of Health. When you do a reorganization, it's common to look at the rules. And we got this first page of rules, so I would like to add that to the agenda.
Which first change of rules are you referring to?
Is it on our packet?
Yeah, it's on the first page, backside. Comment?
Okay. You'd like to add that in what respect?
I would like to make a couple amendments to these rules, so I would like to, before we do public comment, I would like to add which would be Board of Health public comment to the agenda.
It's
What number are you?
The first page of the
first
board
page on the
packet,
backside.
the public notice backside.
No, it's
public
okay.
notice.
Separate page.
So what rules do you want to add, Sheriff?
No, I just want to change a few of these.
Okay,
So do you want me to make that motion now, or do you want to, you think we can do that without adding it to the agenda?
what's the board's pleasure?
I think if you want to amend the agenda, you need a motion, and I think if there's a rules committee in place, we should let the rules committee in place, that we have in place to deal with the rules.
Are you talking about suspension of rules?
No, I'm talking about these 12.
No, I understand that. Is there, you said you had 2 specific rules in here that you wanted to address. Is there something that you would like to suspend for this meeting?
Yeah, I
We'll
guess,
do too.
yeah, I guess so.
Okay, which rules specifically do you want to suspend?
I would like to suspend rules 5 through 12.
You're opening up it looks like you open it up there. If you want to speak, you just come up and speak as long as you want it to, and want to. And we've got
I
it
think
pretty much
before we
worked
go-
out here that you've got. And I don't have anything with the audience speaking. I think they should be able to say what they want to. But I mean, I don't want to be here until 10 o'clock tonight or 12 o'clock tonight.
Point of order, Mr. Chairman,
Telling us
Good.
what to say.
Okay.
if we're going to amend the agenda, we should have a motion to amend the agenda. It should be seconded and then debated at that point. So
I
prefer to
agree.
follow that
I agree.
procedure.
So. Mr. Rubin.
I will make a motion to amend the agenda.
And how do you want to amend that agenda? Sir? I know. I want to know what his full motion is before.
I would like to make number 5 to 3 minutes and then delete 6 through 12.
Could you read those out loud, please, so I know what they are?
There is a 2-minute time limit for each speaker. There will be someone keeping time. After you state your name and spelling, they will start the timer. Once you hear the ding, please be respectful and end your comment. A speaker may speak only once at public comment. There's no provision for another audience member to donate their 2-minute time to the speaker. The speaker will be out of order if the speaker disrupts the meeting, fails to feature main by speaking longer than the allotted time, by speaking vulgarities, or by making a personal attack on a board member or health department employee that is unrelated to the performance of that person's duties. If the speaker is called out of order, that speaker will not be able to speak again at the same meeting. If the speaker continues to disrupt the meeting or is disorderly, the chairperson may request the removal of the speaker by law enforcement. Members of the public shall refrain from interrupting the designated speaker. The chairperson may interrupt the speaker at any time to enforce the rules. Members of the public are not to approach the board members or distributing materials during the meeting. Members of the public shall not engage in disruptive, discourteous, belligerent, impertinent, threatening, disparaging, or otherwise uncivil behavior. Members of the public who refuse to conform with the rules despite being cautioned to do so by the chairperson may be asked to leave the meeting and or result in a suspension of proceedings and adjournment. The chairperson will have the discretion to permit members of the public to speak at times other than the time reserved for public comment.
And you're asking that we remove all those requirements?
Yes, sir.
Okay. Is it time for debate or have we got a second?
It's been moved by Mr. Rubin. Is there a second for that motion? To suspend, to alter rule number 5 from 2 minutes to 3 minutes, and to suspend rules 6 through 12.
I will second because I got questions and this is a good time to answer them.
Okay, so it's been moved and seconded. So, debate. Mr.
First, can I
Coons.
get a clarification question?
Yes, well, let me give this clarification first, Matt, and then we'll have you go. Go ahead.
So you mentioned you guys have a committee right now set up for, is it rules and bylaws or bylaws?
It's bylaws.
It's a bylaw revision
Okay,
that is being done by the Program and Evaluation Committee. We've met 3 times? We've met 3 times,
so
so we have
board rules are a little bit different than bylaw. than the bylaws. So
Correct.
that's what I want to make sure, because I didn't want to step on the toes of the committee that's already doing the work. So thank you.
Okay, I have a question, and I'm not cutting you off.
I'm with you.
I have a question about these rules. Jennifer, you might be able to help me here. Who presented these rules and were they voted on by this Board of Health?
I believe it was the October or something. No, what is it?
November.
It was November. Yeah.
November meeting, and they were approved by the board?
Yep.
Okay.
Mr. Chairman, Lisa Vogler, if I may make a comment.
Go ahead, ma'am.
Some of the rules that have been read, I tried to pull them up, but I couldn't find them at the moment. Some of those rules come verbatim from the Open Meetings Act. So in fact, some of those rules are set forth in Michigan law.
Okay, thank you.
You're welcome.
Mr. Coons?
Okay, so I think before we change rules that have been established and there's a precedent, we already found out there's possible legal conflicts here. And before we step into hot water without legal counsel or without understanding exactly what we're doing, I think it would be, if we want to amend rules to public comment, I think that would be appropriate to take up at another meeting and have that on the agenda where we have a debate and discuss that, and we have time to think about it. Or we could pass that job to the bylaws committee, which is already looking at rules. It seems like a more orderly process. And I think to just change rules that we have in place already that have been a precedent, that could have potential legal consequences. I think it would behoove us to table that and to take a further look at it and take some time to think about it.
Mr. Rubin.
Yeah, I disagree. I think we had for, I don't know, 20 years, we've had 3 minutes for public comment, and that got changed. And we need to listen to the people, and free speech is allowed. We are conducting the meeting according to Open Meetings Act, and that's the chairman's rule. Job to facilitate a meeting according to the Open Meetings Act. And to just say that some of them come from there, well, there's a whole bunch of rules in the Open Meetings Act that aren't on. So we're, to me, that's mute. I mean, if you want all the rules for the Open Meetings Act, we need 4 pages. So I disagree.
In that case, I move that we amend the motion. I'd like to propose an amendment to the
Well,
motion.
I think before you go there, Matt, Mr. Pallarito, did you have some input there? I thought I saw your hand raised. No, okay. Mr. Marcus.
My only input would be, I agree with the change 2 to 3, which I think we can make that easy.
I
for us.
think that's.
But since we listed the 5 through 12, I would like to take a look at number 10 and see if we're willing to include this change. Members of the public that are not to approach the board members to distribute any materials during the meeting. Okay, if we get it beforehand, that's fine. But what I'd like to know, what I want is any materials must be accompanied by clear indication of who and contact information, who presented. I don't want to get just random pieces of paper with information on it that doesn't have who distributed it and a contact way of reaching them. So if we could figure out a way to wording to say that without identifying who distributed it in writing, that would be great. Because I don't like coming to a list of stack of papers from random people or organizations.
I agree with you, Mr. Marcus, and I think your point helps me make my point. To have a big discussion right now about how we're going to change these several rules, I don't think it's productive of what we're doing here today. And like I said, we could be stepping on some toes. And I think if we take time to think through some of these and take some suggestions from members, we have a much better chance of coming up with a set of rules that would be productive for us going forward for the next year, rather than just try to make a short-term decision for this particular meeting without having thought about it.
Any further discussion?
Did you offer an amendment to address?
Yeah, I
the
would like
format?
to address, I would look at amendment. I propose that for this particular meeting, I move that we allow, I'd like to amend Mr. Rubin's amendment, minutes of public comment instead of 2 for this meeting.
Mr. Rubin, you made the
Do I have a
initial.
second?
Well, okay, so it's been moved that we amend by Mr. Coons and seconded by Ms. Roloff. But the initial amendment or motion was from Mr. Rubin. Are you okay with us moving from 2 minutes to 3 minutes for public comment and not amending the rules further?
Well, we have a motion on the table, we have a motion on the table, so it really
Okay.
doesn't matter what Mr. Rubin thinks at this point.
Okay,
It will.
well, let's have further discussion. This is my first time as chairman, guys, so we'll get through this. Go ahead, sir.
Well, you verbalize what your intent is, but if we put it in the motion,
Yeah,
it becomes not shelved or tabled or kicked down the road. So if there's a way we can include that into the amendment, that this will be taken up either again on an agenda, whether we agree on it or within the committee. I just want
Could I-
curious to know.
could I clarify a motion?
So
Please.
Okay, so there's been a motion that we move public comment to 3 minutes and eliminate, I think it's at 6 through 12, the rules are listed.
Yeah.
I move that we amend that motion to recommend that the rules bylaws committee take a look at the rules and that members of the Board of Health submit those, the recommended changes to that committee. And we look at those going forward. And that for this particular meeting, we allow 3 minutes for public comment.
Jennifer, did you get all that?
Yep.
Okay,
You want a second on
I
that?
do.
Moved by Mr. Coons, seconded by Ms. Roloff. Any further discussion? I would briefly, I don't want to interrupt anybody here, but I would briefly suggest that we add that to our next meeting's agenda so that we can, because I don't want this to drag out
We
either.
have our committee do that and then bring it and have the Board of Health submit their ideas to the committee and then we, as a committee, we present that to Board of Health and make the discussion
At the
process.
next meeting,
Yeah.
Well, if we can get there the next meeting.
that's the key.
We have to, but by the next meeting, or else we're gonna have this discussion at the next meeting.
All right, well, we're gonna have a meeting next Tuesday, am I correct? Can we put it on the agenda of the Rules and Bylaws Committee for next
We'll just-
Tuesday and hopefully we can get something accomplished? That makes
That
sense?
sounds like a plan.
Okay.
Let's do that.
All right, so it's been moved and seconded that we move rule number 5 under public comment from 2 minutes to 3 minutes. And that the remainder of the rules will stay in effect. Rule number 6, because of that 2-minute time limit, would also need to be amended to 3 minutes time limit per speaker.
I think we can understand that we're gonna allow every speaker through.
Okay, everybody gets to talk for 3 minutes. Are we in agreement with that?
Yes,
Okay, moved and seconded.
we need to vote on the amendment. And then we can vote on the motion.
So on the, all right, let's vote on the amendment to the agenda. All in favor, say aye.
Aye.
Any opposed? Then the amendment to that agenda would be rules number 5 and 6 are moved from 2 minutes to 3 minutes for public speaking. All in favor, say aye.
Aye.
Any opposed?
Aye.
Well, you didn't complete the.
Well, he made the motion and it was amended and we voted on the amendment.
voted on
Now can
We
vote
voted on
the
your
motion.
changes first. Am I getting it backwards?
Yeah, so now we need to
Okay, I'm
vote on the
sorry.
motion. I
Okay,
think it's passed.
Not everybody does it that way, so
Okay.
that part of the Roberts rules is not set in stone, by the way. Once an amendment is approved upon and we vote on it, you don't have to go backwards and vote on something that we all agree we're not gonna vote on.
Okay.
So it's kind of silly.
So it's passed.
all right. Jennifer, are you good?
I'm good.
Okay,
Thanks.
so we have amended those rules. Everybody gets 3 minutes. Now, Mr. McGinnis was our timekeeper. Thank you. This is the list of folks that want to speak. It is. Thank you. I have a volunteer. Mr. Palladino is
Zinger.
getting his timer ready. 3 minutes, and Rob, I would ask that you at 30 seconds left, just say 30 seconds. Okay? Actually, ladies and gentlemen, because of the fairly close quarters here, I would ask you to stand just to the right of Mr. Rubin, state your name and where you are from. And your 3 minutes will start after you have stated your name and your residence. Are we good to move on, ladies and gentlemen? Okay. Thank you, Matt. You're all right. You stay right there. Do I have a motion to approve the agenda as amended?
So moved.
Moved by Mr. Coontz. Is there a second?
I'll second.
By Ms. Roloff. Do we need a voice vote? Jennifer?
Okay, Rubin,
Yes.
Marcus,
Yes.
Rolla,
Yes,
Hankins,
Yes.
Kuntz,
Yes.
Palladino,
Yes.
Brown.
Yes.
All right. Item number 6, public comment. I'm going to go right down the list here as they are in order. And I would invite Ms. Myrna Holland.
Thank you for the 3 minutes. Might be able, maybe I can take this, understand me, I'll be recent. This is where you want me?
Yes, that's fine.
Okay. My name is Myrna Holland, I'm from Elk Rapids, Anderson County, and I'm a registered nurse. First, I want to start with a quote from Michigan's Guide to Public Health for Local Governing Entities. Quote, as a county commissioner and board of health member, you have a legal responsibility to protect and promote the health of your community. You have an opportunity to provide vision, leadership, and policy to make your community a safer, healthier place to live. We all want to be done with this pandemic. But that means reducing the places that COVID-19 can thrive, mutate, and spread. It does not mean being done with the pandemic mitigation measures. To have the virus under control is going to require continuation of what I consider some annoyances and others see as sacrifices. We need to be sure that ignoring those annoyances doesn't result in the sacrifice of human life. Too many have died already, even after we identified ways to reduce deaths and hospitalizations. In our health district through January 28th, there have been 263 COVID deaths reported. That number would essentially eliminate populations of villages such as Blaine Falls, or Alba, or Wolverine, or Levering. I'm mystified by the level of anger directed towards the health department, which your communities have trusted for 90 years to protect their well-being. Dismantling the four-county organization is not a fiscally responsible course of action. To independently provide the high-quality range of services now offered is not affordable nor sensible. Services such as women and infant care, behavioral health and substance abuse treatment, sanitation, dental care, restaurant inspections, and health education. I also can't imagine finding enough competent professionals willing to fulfill the requirements of separate departments or in seeing responsible businesses wanting to relocate here. There is good news. The Omicron cases are beginning to fall. As of January 29th, your counties have had a small drop in cases from the previous week. What I'm here to ask is that you let the health experts do their jobs and that you devote your time to finding ways to make it easier for them to keep us healthy and to keep those case rates coming down. Thank you for your time.
Thank you, Ms. Holland. I'm gonna mess up this next name. Dixon Gutterar?
Yeah, thank you, very good.
Did I get it?
You did.
Oh, okay.
Perfect police officer, right?
I am.
Yeah, no,
We would call that common spelling.
That is, it's a name that's from Alsace Lorraine. One part of Germany, now part of France. And I want to apologize, I take your point. I'm the guy that gave each one of you a copy of this. At first I thought, well, I'm not going to read this, and then I realized this is going to go into the record, right? This is recorded.
Correct.
Okay, well, first of all, I'm really happy because there's federal news and my grandchildren, I got 2 of them, 5 and under, can now get the vaccine. The other good news, it's local. If anybody saw this on the front page of the Petoskey News, is this health department now has a new mobile unit that can reach rural areas, okay? This health department performs essential services. I didn't realize this till I looked it up. People get housing assistance, who knew? People get food assistance, and then people, if your teeth go bad, it'll kill you. There's certain kind of dental work that's not taken care of. So, but this is I handed this out. It's a brief history of health mandates. There's nothing unusual about health mandates. A guy I talked to me today is a retired 40 years epidemiologist, gave me this today. The famous code of Hammurabi, the first written legal code in Western civilization, was about 70 to 80% specific to what we today would classify as public health law. It had specific regulations on markets, agriculture, and here we go, sanitation, food, and water safety. The code was transferred throughout Europe for centuries. English common law, the foundation of our legal code today, think founding fathers, was deeply rooted in public health and safety. The liberty of individuals to act against the common good in violation of public law is a clear violation of the legitimate police powers of the state. The consequences of breaching police powers is criminal. For instance, we have people in prison today because they were knowingly exposed to partners with HIV, being themselves exposed and diagnosed. Think about typhoid Mary. Okay? Do you know what that is?
people who challenge established public health laws are in fact public health threats to the common good, which is the basis of the rule of law. Now, let's talk about mandatory vaccinations. During the Revolutionary War, Washington made sure that his troops are vaccinated against smallpox. A milestone in 1853 was in the compulsory vaccination required infants in England and Wales to be vaccinated against smallpox. The Supreme Court in 1905 ruled that smallpox vaccine can be mandated, ruling legal with
30 seconds.
yeah, okay, here we go. Everybody knows about the Iditarod trail, right? The Iditarod race, that was to combat diphtheria. People today are vaccinated and it's mandatory and there's nothing unusual about it. My alma mater, Indiana University, told students you can't come to school, you can't come on campus unless you're vaccinated, and the US Supreme Court held that to be legal. State of Maine is requiring all people to be vaccinated, and the Supreme Court has upheld that ruling. So mask mandates are also legal under the state health code.
Thank you, Mr.
They're
Dodd.
not worth getting bent out of shape.
Ms. Kim Clark.
Thank you. And I'm from Clark from Antrim County. And there are a lot of men in the audience. I don't know how this will. My audience is maybe slightly different than I expected, but hopefully you'll understand this. I recently made a Waldorf doll for the first time. If you're not familiar with this craft, the doll is made with natural fibers such as wool and cotton. The head is formed by rolling strips of wool into a ball shape, and then string is wrapped in certain places around the ball to create indentations that eventually become the facial features. The body is created by cutting out and sewing each body part and filling them with more wool. The eyes, nose, and mouth are sewn onto the face using needlepoint. Finally, the hair is made by crocheting yarn fashioned to a cap sewn to the crown of the head. Now, I had never sewn anything, never crocheted nor tried needlepoint, and there were a few naughty words spoken as I rewrapped the ball of the head for the fourth time and re-sewed the eyes so that they didn't look googly about 3 times, and ripped out and redid the crocheted hair cap 5 times. Now, when I declared to my dear friend who was guiding me through the project that this doll making process has been very frustrating at times, she gently replied, yes, when I get frustrated during the process, I think of the child I'm making the doll for, and that keeps me going. Great frustration and exhaustion are inevitable with this pandemic. It's new, it's novel. We don't know what to expect. But the best advice that we're going to get is from the experts, the people who had the education behind them and are out there tirelessly working to figure out the best path forward. They know the current data and safety measures that they're telling us to do are the very best that we know for the time we're in. They save lives. And what could be more important than that? And when we look back at this time, we'll know that we did everything we could. I know everyone here, no matter what our feelings about this pandemic or political place that we find ourselves, we would all do anything for our loved ones and our friends, no matter what the cost. I know that about any.
30 seconds.
And so, why not do the very best that we can? And I believe that's what the health department and the people that work there have tried to do for us. They always have. And why would they change now? It makes no sense. So please support the health department of Northwest Michigan and the difficult work they're doing just to protect us.
Thank you, Ms. Clark.
You're welcome.
Brenda, I will have difficulty with your last name.
That's fine, I'll spell it for you.
Okay.
Brenda Kobita, K-U-L-B-I-E-D-A. Question for you, why does this health department officer not pursue and allow treatments of COVID-19? Besides the COVID vaccine, that is it because the pharmaceutical companies will not make any money on them? Does anybody ask themselves how much money pharmaceutical companies are making off the vaccines? It's billions of dollars, billions. The prevention measures that the health department has taken have failed to stop COVID from spreading. Testing, distancing, vaccinating, and forcing our school children to wear masks does not stop the spread of COVID. It has become endemic, which means that we're all going to get a little bit of protection against it without vaccines, which I think is great. This has left me wondering, why are hydrochloroquine and ivermectin prohibited? Why has the distribution of monoclonal antibodies stopped? We're told it's because Omicron is not deadly. So if it isn't deadly, why are our children still being forced to wear masks in school? We need to know why. Medical providers have been forbidden to prescribe hydrochloroquine. Ivermectin is discouraged. Why? The rejection of monoclonal antibodies is the most puzzling to me. I have relatives in the Upper Peninsula who received these treatments when they were sick with COVID. They swear they worked. These people were only sick for a couple days. I was sick for over a week with COVID. I didn't get the antibodies. They did. Why are we not pursuing this more? Why is this health department not endorsing this treatment? In closing, I wish to make a comment on the departure of Mr. McGinnis from this Board of Health. He was quoted in the press stating he thinks this board is not only dysfunctional, but dangerous. I don't believe it is either. With the departure of Ms. Bargy and Mr. McGinnis, I believe we will see progress toward normalcy. I have faith in you all. I hope Mr. McGinnis is replaced by someone who is in favor of lifting the mask mandate on our school children and less focused on self-promotion.
30 seconds.
I hope this board will take steps to rescind the health officer's school mask mandate. And please look into the antibody treatments and the fact that we all probably have antibodies that protect us from COVID-19. Thank you.
Thank you. I'm gonna try this one. Krista Zolkarewski,
Zelkowski.
I apologize. Okay.
First off, I'm gonna just start off today by commenting, I guess, on what Mr. Parker, our superintendent, had said today in a short, well, this very long, drawn out, swoop comments. So our positive COVID-19 cases declined last week as the highly contagious Omicron variant continues to spread. Our new guidelines, which I didn't open that yet, related to school exclusion reflect the approach from our local health department and rely on two main pillars, staying home when you are sick, which I think we can all say, we've kept our kids home from school if they're sick. I don't have to call a doctor and make an appointment if my kid has a very slight fever and has sinus congestion. It's not gonna happen, nor do I have the money to do that. So for him saying that the cases have dropped, my children have all immensely suffered with the effects of wearing a mask and these mandates that have to stop. And that's all I'm going to say today. Thank you.
Thank you. Cindy Banner.
To be organized. I appreciate Cindy Banner, Charlotte County. I appreciate the 3 minutes. So I'm here today for the lack of dialogue between this community, our communities, and the health department. No criteria and data have been established and support the public health order. No established criteria exists to rescind the public health order, and we never have any regular updates regarding the public health orders. I looked through all the information on the website for our local health department, and then at the state health department. And I just don't, it makes zero sense when that we keep this mask mandate in place. When I look at what our public health officer put out, that how we're moving and shifting and evolving, we're protecting our residents and communities through preventing severe outcomes and protecting critical sectors of society. We won't be able to stop cases of COVID-19 from happening, but focus on getting the public the tools that they need to protect themselves as communities spread is prevalent. You know, when we look at masking and what came out with the Michigan Department of Health and Human Services, and we can see by what masks are being worn here, the cloth masks and the surgical masks in the schools aren't effective. We know that it's KN95s and N95s. That's what our public health officers learning. So we're gonna mask in the schools, but we're not gonna put the proper mask on them. Makes zero sense. Zero sense. So then if we look at, you know, what schools are masking, okay? Let's look what schools are masking. 63% are not masking. 37% aren't. 4 aren't masking. When you look at the Michigan Department of Education and you look at all their data and the studies that come out of schools that are masked versus unmasked, what's effective and what's not effective, there's virtually no difference. It's based on 100,000 students, 1.7 and 1.9 masking versus non-masking. Makes no sense, but we keep masking. Absolutely none whatsoever. If we look at our region and we look at the school K through 12 school clusters and outbreaks, we're in region 7, which includes 15 counties. And you know what? We have the lowest number, 5. Lower than anybody, but what happens here? We keep doing it. My son, he's not vaccinated, and you know what? He is targeted and he's bullied by students and teachers because they know he has to get tested as an athlete, that he's not. And you know what? He has no alternatives, unlike a public health officer who can file and do something about it. I said, when we thought one city said no masking, and so he said, I don't have to wear a mask on January 24th. And you know what happened to him? I said, you know what? Go ahead, don't wear a mask. And he said, you know what, Mom, you know what'll happen? They'll say, I'm insubordinate.
Thank you, Ms.
And I'll go to the office
Ms.
and I'll
Your
get
time has
points,
expired. Thank you.
and then I can't go to the.
Thank you, Ms.
That's absolutely absurd. Thank you for 3 minutes, and 3 minutes, you know what, I took the time to go through all the data. And
Thank you,
to
Ms.
do
Mann.
the discussion
Thank
as
you.
possible.
Mr. Ian Murphy.
Ian Murphy, Otsego County, and the owner of the Iron Pig. Hopefully I won't take up all 3 minutes. I'm not here to talk about vaccines or mandates necessarily. I'm here to talk about the law. What happened a couple of weeks ago? First, let me start off. The 1945 Emergency Powers of the Governor Act, in recertified questions, unconstitutional, right? Executive orders, gone, 0 for 1. Government then moves right to Health Code 333.2253, November. This one page right here. November 15th, 333.2253 is what shut down restaurants, gathering and face mask order. So everything has been built on this right here. Guess what? Now unconstitutional. You know who said so? Judge in Otsego County. You know who it's binding against? State of Michigan. Precedent has been set. Okay? Right here. Very last page. So eloquently put, MCL 333.2253 is hereby severed from Michigan's Public Health Code. Okay? Anything that you folks have on the books that relates or references 333.2253, you folks now have a duty as public officials. I have to write this down. Public officials, you have a duty to drop the mask mandate. 333.2253 is cited in every single mask mandate and any other mandate that is being enforced right now. Anything that is referencing that, done. Your counsel is gonna disagree, which is why I did not want to preempt Ms. Moore here tonight. She knows these things much better than I do. I've been speaking with her via proxy, our attorney. I wish she were here tonight to give her side. Again, she's third party. She's gonna tell you exactly what's going on. She agrees with the ruling, just give me a heads up. We'll see if she ends up back on your guys' docket or not, now that you know that. So what has to happen moving forward, you guys? Look at the law. It's been set in stone. They can appeal, they're going to appeal. There's some stuff coming up this Friday. The judge is giving them a chance to have oral argument. They have nothing to stand on. The one page unconstitutional. The last thing that you guys get to look at, and what I suggest you folks look at, that you have your attorneys look at moving forward, if you want to enact any sort of mandates, the Emergency Management Act is the one last thing that the governor has to use still. 28 days, she can shut everything down. If you don't like the color blue, you can't sell blue paint, sorry, that's an epidemic, pandemic, whatever you want to call it. Sorry, I think I said pandemic, my bad. Freudian slip. That's what you guys need to be looking at. You can say all this time tonight, all this anger and emotion is coming from 333.2253. That's no unconstitutional. Thank you, guys.
Thank you, Mr. Jen Thompson.
Hello, my name's Jen Thompson at Siegel County. And I am curious, we always talk about following the science and the data and the numbers and the science and the data. And I went on, and I'm just surprised because we have not ever mentioned yet the Michigan.gov website that talks about the number of beds, how many masks, how many gowns. And every Monday, Wednesday, and Friday, it's updated, and it tells you how many COVID patients, how many pediatric patients, the percentage of beds that are being occupied. And I'm so tired of hearing the medical profession saying, we are at our maximum capacity, we can't take another person. I literally just looked at it as I was sitting here, and as of 1/31/2022, Siegel County had 7 COVID patients, 2 in ICU. We are at 46% of our bed occupancy. So I'm really confused when it comes down to the this medical data and the science, and that we're overwhelmed with this COVID. McLaren Petoskey, 15, that was the highest one I could find in our Region 7. That was mentioned earlier, we're Region 7. You can go and find this information for yourself. 96% of bed occupancy. Charlevoix, 0. Zero COVID patients, 0 in ICU, 12% bed occupancy. I literally just looked at this while I was sitting in the chair. So I don't understand where we're getting the numbers, the science. I honestly think it's malarkey. I went to our local health department just this last week, and I stood in front of the windows where you can't see anybody because they have blinds, so you have to knock. And they open up the blinds, and I gathered all of the COVID information that was there for public. And every single one of the packets on every single one of the COVID information, scientific data was incorrect. And I said that to the person sitting there, and I said, I don't understand, is this all incorrect? And she said, let me take a look at it. She gathered the information. Yes, it's incorrect. So she shut the blinds, and I heard her printing off all the new documents. She came out and she took all of the documents that were up there and replaced them with new. What if I hadn't said anything? I mean, are we really, I can't, it's laughable. Thank you. We say, it's mandated the masks to stop this. It's time to take the masks mandate out of school. If you want to get vaccinated, you can. There's 2+ vaccinations, +3, +5, +5, 6, 7 boosters to take. You can, that is an option, and allow that, but allow us to also have our freedom. It's time to take the masks off the children. I will not stop. I'm here to represent the children, and I'm gonna keep going and going and going until it gets done. Thank you, board.
Amy Carell. Did I say that right?
You said it right.
I'm getting a few of them.
Oh, most people say Coral.
Okay.
My name's Amy Perrell from Otsego County, and I've heard some really good things here today. I'm encouraged by the change in the board, and I'm expecting to see good things come out of it. I had 3 whole minutes, and I'm not gonna say them all. I just want to let you know, just recently a bridge collapsed in Pennsylvania. I don't know how many years it had been there. It's decades, most likely. And it happened unfortunately when the president was visiting that part of the country. And I thought it was kind of symbolic of the need for a rethinking of how we should approach the problems facing us today. Our infrastructure physically needs to be overhauled. By infrastructure, I mean schools and health departments too. How can we rebuild on a crumbling structure? New ideas and old values may be our answer, and I emphasize the old values. Government schools with the exclusion of excluded Christian values for a long time, and they've cheapened the outcome. A return to schools that also teach real material and real values instead of trying to change the language. I don't know how many unfortunate changes in language I've seen over the years. Health departments that care for those who cannot afford a doctor or who need the normal shots should be a freestanding building and not in the schools. Thank you.
Thank you. Sarah Storm.
Sarah Storm, East Jordan. Also, thank you for the 3 minutes. I had a lot to say. Last month that I didn't get sick, so I'm gonna say a little bit more now. The psychological damage being done to our children is huge. From mask mandates, lockdowns, and quarantines. Each one plays a role to the deterioration of our children's mental health and well-being. There's a huge surge in suicide rates in children as young as 7 years old. There is a surge in drug abuse in adolescents. There are drops in IQ along with a decrease in fundamental development and important milestones our children should be making. They're failing over 20%. 20%, just saying that. These are all facts. You guys all have the same information we do. What we know is that our children need to see faces to learn to speak in an internet socially. Like I said last week about my son's autism, his speech problems. He needs to see mice to be able to speak correctly and to have progress. We're blocking their ability for their brains to assimilate the information needed to become functional adults and citizens. Look at all the bomb threats made within the school year this past, 6 months. The damage we are seeing is just the tip of the iceberg, and unfortunately will go on for generations to come. The psychological welfare is one of the most underrated stories being told. And why is that? It's because it's dangerous to speak the truth. Please be on the right side of history and get these masks off our children. The state should not be inserting themselves into family or their schools. And then I just want to touch base on mask violations that I've seen just in last month's meeting. One was wearing your mask around your neck, under your nose, wearing a mask in your chin, dangling from one ear, on your arm or wrist. Men with beards, they should have them shaved or a mask filter or brace. No eating or drinking with your mask on. Improper hand washing procedures before putting your mask on and after you take it off. And that's what, 9 examples, just from the meeting I seen last week. So if you guys as adults, and I'm not saying all of you guys, as adults cannot properly wear these masks, what makes you think our children are doing it properly at school? And what is that so if they're not even wearing them correctly?
Judith Thurston.
Oh, Garrett, sorry.
Thank you.
I'm here to thank you. I was here in November telling you I had just recovered from COVID and just found out we have a health department, and I was anxious to go get some services. So please keep it going for me. And it's still going. I went in December and got a flu shot, and I went this January and got a booster. So I'm pretty much good to go. It seems like the health department is still in a lot of trouble, and everybody wants to do something to change it, even though it's been here for like 80 years, and this is, as far as I know, the first time there was a problem. But thank you for keeping it going, and I'd appreciate it if you keep it going a while longer. I might be able to use a shingles vaccine or something. Thank you.
Thank you. That's the last name that I had on the list for people who had signed up to speak. Are there any other members of the public who would like to address the board?
I know I already did, but if anybody, I didn't mention this, if you guys have any questions, I'm available or I'm willing to take any time from Mary's spot there. If you guys have any questions, I might be able to answer for you.
Thank you, sir. Hearing no further desire for public comment, we're going to close that section. And we will move on to staff reports. Ms. Peacock.
Okay. I sent you my regular report, which is focused on public health finance as part of our first few meetings of the year. This year, we discussed the possibility of including some overview and orientation materials as we moved forward into the year. And so the first month we focused on governance. This month we are focusing on resource stewardship as part of that governance. And so I wanted to provide you with some information about how public health financing works, the sources of revenue that we rely on, and also included a link to our agency budget. So I sent you the report electronically with lots of links. I'm wondering if you want me to go through any of that, and then Terry Tellis is also available on Zoom if you'd like her to walk through the PowerPoint that she submitted along with my report.
Did any members of the board have any specific questions regarding the Board of Health report submitted by Ms. Peacock? And I think, I'm the guy who lives in Charlevoix, and I think I'm the last one who gets these in the mail. I'm not sure why, but does any member of the board have any questions regarding the information provided by Ms. Peacock in our packets?
Or anything you want me to elaborate on?
Yes.
I just have a request. Due to the fact that we don't have a presentation, there was a response letter to the presentation. I would like to see that included next time too, just add it to the next agenda so it's consistent. And
Oh,
don't
sure.
forget about it.
The second memo?
This same thing I'm gonna attach to the next meeting in conjunction with whatever it says, so we can.
Sure, yeah, absolutely. It also includes some response to a couple of the other agenda items, so I can talk about that.
So
when we
this
get to
exact
those.
same letter, please attach to the next committee along with the presentation that we're gonna have.
I got a couple questions.
Mr. Rubin.
Yeah. Lisa, we got 43 health officers in Michigan,
45.
45,
Mhm.
and how many of them have mask mandates? How many have issued mask mandates?
I think as high as 16 have issued them. I think there are 5 left that have them, a couple of them were expired last week.
And so of 5 left, how many are as broad sweeping as ours? And by that, I mean, ours is age 5 to
K through 12.
18.
K through 12, yeah.
Yeah,
Yeah. I think all of the ones who are left in place are K through 12. And I've got an entire update for you regarding that agenda item. So if you want to move on to that, I'm happy to do
no,
that.
we don't need to, we don't need to mess up the agenda. We can handle that when
Well, okay, so we have written reports submitted by Dr. Meyerson, Ms. Jacknovich, Ms. Thompson, Mr. Terrell, and Ms. Sunmacher. Before we get to each of those written reports, I want to know if anybody has any questions for Ms. Peacock regarding her Board of Health report. Go ahead, sir.
I don't see any explanation as to what constitutes an expiration in your report, what would trigger an expiration, and
Okay.
what triggered other expirations of their mandates in other counties.
I think we have that under item number 8.
Oh,
Yeah, if you want me to go
So,
on to that. and-
So I revisited what she offered, sorry.
That's okay. No, that's okay. You got it. Okay, so if there are no questions for Ms. Peacock, are any of these other staff members present via Zoom
They're all
or
present.
they're all present?
Except for Dr. Meyerson, who's away
Are
tonight.
there any questions regarding the written reports that have been submitted? Hearing none, I want to move on to item number 8, which is the metrics and data update relating to lifting of the public health order regarding masks in schools, which is, I think, where we were headed. Mr. Rubin, this was placed on the agenda at your request. Do you want to open that in some way?
Well, I just have concern that from the time we first had mask mandates issued, as time goes on, I'm seeing more and more lifted. And this health department hasn't lifted theirs. And I hate, people in Antrim County have told me, every day this mandate is on, there's people that are upset about it. They're coming to meetings, we heard them again today. If you want to wear a mask, wear a mask. If you don't want to wear a mask, don't wear a mask. But every day that we have a mandate is another day that our health department is under a microscope. And we all make mistakes. I make mistakes. But when we're under a microscope, those mistakes get pulled out, picked on, written on. So I want to get out from under the microscope, is all I'm saying. I think I'll just leave it at that.
So do you want to see the data and metrics that I've prepared to share with you? Which will answer some of your questions about the intentions about lifting the mask mandate and all of
Is
that?
it in our packet?
No,
It's,
no.
I would like to see that.
I think,
Prepared it, and I'm curious myself, so I appreciate it.
I usually give some kind of a COVID update at this meeting. I mean, it's not unusual.
right.
So,
I think because it's specific, it's specified on our agenda, I think that we do need to hear that.
okay, great. I would be happy to share it. I'm going to share my screen so that you can see it. Over to slideshow here. Okay. So I wanted, it's hard to talk about the mask mandate ending without talking a little bit about the beginning and the reason for it. So I'm gonna just kind of give you a broad overview. And I'll go pretty quickly so we don't take too long here, but mainly the approach to the pandemic has sort of been set by MDHHS for the state of Michigan and organizes the objectives into 3 main areas. So our priorities as we're trying to protect the public and, evolve with the pandemic is to, number 1, prevent death and severe outcomes. And that is by doing things like, making sure that we have vaccinations and booster doses accessible. Making sure that there is early access to testing and therapeutics. I can talk about therapeutics when we get down the slides a little bit further. There were some questions that came up in public comment about that I have some information about. And then protecting our most vulnerable. And right now that really is looking like making sure that people who reside in long-term care facilities are having their booster shots like they are supposed to, and that staff are vaccinated as well. Number 2, protecting healthcare capacity. This has been a concern in our area throughout the pandemic, but especially in northern Michigan since about mid-August. the hospitals and EMS systems have been strained. It's gone up and down a little bit throughout that time, but overall, a high level of strain that has been really a huge strain compared to the beginning of the pandemic in some other parts of the state. And so what we're trying to do is reduce that community spread as much as we can. A surge is going to be, I'm sorry, did you have a
Point of order,
question?
Mr. Chairman, could we ask the audience to break for comment at this point?
Yeah. Okay, ladies and gentlemen, first of all, I wanted to say this prior to Ms. Peacock starting. Thank you for your attendance today, number one. Number two, thank you for conducting yourselves in a respectful manner. I'm going to ask that you continue to do so that we don't, as board members, we don't get distracted.
It's difficult for me to hear this.
Okay,
Thank you.
thank you.
Thank you. As well as reducing the severity of cases and the need for ICU and ventilators. The third bucket is keeping vital infrastructure. I'm not sure if I can move that the way that is on the screen right there or not. I don't think I can. Sorry, you can't see all that, but it says keeping vital infrastructure functioning. So this means keeping kids in school, learning. It means, keeping local government functioning, our local economy, keeping businesses open. And there is an evolution happening. The pandemic looks different now than it did. We've had several different variants that have had several different types of impact on the health of the people in Michigan and across the United States. And across that time, we have had to use a concept of a risk budget. What level of risk are we willing to accept related to this pandemic at this point in time? And it's different now than it was before with the variant that we're facing. And I'll talk a little more about that as well. But a really important part of the pandemic response now is transitioning some of the stuff that has traditionally throughout the last 2 years been done by the public health department to the hands of the public, to make sure that people know that they have access to what they need if they may have COVID, being able to pick up those over-the-counter tests and use them at home, and make sure they know what to do if they should test positive in terms of isolation and quarantine to protect those around them. So with that overarching, Matt, are you able to move that thumbnail out of the way? Matt's listening. I don't know who has.
Can you minimize at the top of that thumbnail, Lisa?
It's not mine. I think it's on the computer that is running the thing. So I can't. Sorry, I would be showing you the curve straight up recently with the Omicron surge. And this is just the local picture of our average daily cases. Thank you. Thank you for that. So you can see this starts in March of 2021. In April, we had a peak. We had that nice curve down during the summer that everybody enjoyed very much. We went up again with the Delta variant as school started, and then had some ups and downs in the fall, having a little peak around Thanksgiving, going down during the Christmas holidays, and then really going up sharply with the Omicron variant. We are starting to see that start to come back down, which is really good news. So this is just a picture of the look at the state as a whole. Somebody mentioned that our area currently has the lowest cases in positivity, and that is true. So that's great, really great news. Right here is region 6. This is broken down by MERC region, in which case we're region 6. When we talk about preparedness region, it's different. At the top, you see the positivity rate, which is starting to go down a little bit. It's even further down now than when this slide was developed. It's at about 27.5%. If you look at the daily cases per million, the next one down, you can see the downward curve, and then the dots are the projections in the coming weeks that those are starting to go down. And the daily hospitalization rate are going down in some areas of the state as well, and over the state as a whole. Our area is still seeing some increase in hospitalizations, but it peaked later, so it may come down a little bit later as well. This graph looks at the case rate trends by emergency preparedness region. Somebody earlier mentioned region 7. You can see region 7 up there. That is our emergency preparedness region. And what we are looking at here is really this, just kind of this picture of the different regions. We are region 7, which is the little salmon colored line right here. And we are in the lower part right here, which is great. We are going down along with all of the other regions in terms of case rates, which is also really important to know. And that's just been over the past week that we're seeing that
Quick
down.
question, would you attribute that lower case rate and the quicker decline in our region to a higher rate of vaccination and the fact that we're going to our schools with masks on?
That could be part of it. There's no way to know for
Yeah.
sure without more
But you need some sort of
information.
correlation. Thank you.
Yeah, absolutely. Even when you start to try and compare schools to schools or counties to counties with mask mandates or not, there's really not enough. We don't have enough unless you're doing a study where you're controlling for some of the other factors that can influence that, like is everybody being tested? Is everybody reporting their positive case? Those things can influence that. So it's hard to draw those conclusions from what we have here. But it might be. This one is case rate trends by age group. And so what we've been kind of watching is where are the highest increases in cases. And, you know, in the last couple of weeks, this is now this gray shaded area. All of them are going down, and the 30 to 39-year-olds on this blue dotted line have the highest case rates most recently. There have been times that our school-age children have had the highest case rates, but not right now. This is a year-over-year comparison of the impact of Omicron on different age groups. And so the 5 to 17-year-olds are first, and you can see that sharp rise up. And just what I described earlier, we had the alpha wave in the spring, and year 2 is the top line, that's 2021. Year 1 is 2020. And then you can see that both years we went down in the summer. We're starting to learn some things about how this virus behaves, which is going to be helpful in planning. The Delta surge is that kind of slow upward rise where we had less, you know, we thought we had a lot of cases, but we certainly didn't have a lot of cases compared to what we're seeing now with Omicron. But we did have a lot of severe illness, hospitalizations, and deaths with Delta. That went down again sort of between the holidays, and then after Christmas went up with the Omicron surge. Same sharp curve upward you see with the 18 to 49-year-olds in the middle. And then the oldest members of our population, 80-plus-year-olds, you can see the very small rise of Omicron. And I think what they're trying to point out in this slide is that that is the age group that has the highest vaccination coverage. In some of our areas, we have nearly 100% of people in that age group vaccinated, and they're having very little experience with Omicron currently. So high vaccination coverage really does translate to less case rate, lower case rate. Cases, hospitalizations, and deaths, we talk a lot about this, and we've been thinking a lot about this recently, and in terms of the mask mandate and considering when it can be lifted. I've mentioned in my memo that we are not looking to be the last health department in the state by any means. We're not looking to see cases completely go away. We're not looking for even transmission to be low or moderate. What we are looking for is something that's not a sharp curve up where it's not the right time to take away any kind of a protective measure, but a sustained coming down of that. And then the other thing that seems to be happening with hospitalizations and deaths, which this slide is pointing out, is that although the Omicron cases went up really high, really fast, the hospitalizations didn't. If you see the red line, that's our hospitalization. See where it matched the Delta wave earlier? It was really similar. It's looking to not be similar to the Omicron variant. So this is a different time. This is a very different time than some of the other situations that we faced. It'll be a couple of weeks before we know if deaths are going to follow those case trends, but we are also hoping that they won't surge up, and they usually follow hospitalizations. So that's good news for us. So this is the modeling update that I presented at the last meeting, and it's just an updated model of that scenario. What we think is that we are at or near the peak level right now, for sure for cases, and I think we're starting to come back down, but maybe even also for hospitalizations. And so the thing we don't know yet are deaths, and you can see there's an optimistic line and a pessimistic line on that last category to the right. You know, they're projecting the more pessimistic view that we would have a sharper increase in deaths than the optimistic based on, you know, the projections in the modeling that they use. But certainly the hospitalizations ended up much closer to the cases than we anticipate. So I hope that the same thing happens with deaths over the next couple of weeks.
You said that's last month's slide?
No, this is this month.
You said you showed it to the last meeting last month, right?
Yep, a similar slide that had different data.
Okay.
So it's an updated
I was
version.
gonna say
of
it
the-
contradicted what you just said a few slides ago earlier.
Yeah,
you said you're at a peak when it was clearly showing it was down. So how can it be at a peak and the slides before showed they're going down?
I said we're at or near the peak and probably coming down.
Well, the other slides show they're going down, so it's not probably, right? It is. Because your slides clearly show all the age groups going down.
Okay, what
So
slide was it?
are
I'll
you
go
at
back
the
to it.
peak or are you going down?
I'll go back to it. We're probably at the peak and we're likely going down a little bit. What
Well, if
slide
you go
did
back
I
two more
say?
slides, you'll see
Okay.
the slide line's
All right.
going down. That's why I'm there, right there. If everything's going down and clearly going down in the gray, how can you be at the peak?
Yeah, different data.
Yep.
So it's case information and one is a modeling projection and this one is case data. So this one is on the actual cases that we know. What we don't know here is we're at the end of that gray shaded area, is it going to go back up or not? The other one is modeling projections. So it's projecting
Modeling.
forward.
Thank you.
Yeah, you're welcome. Okay, so statewide hospitalization trends. You can see again, we are region 7, so we're the green line, second from the bottom. The top trends, we talked about this last month as well. That's region 2N and 2S, which is our Detroit area. And we did talk about how that is, it's not something that doesn't impact the rest of the state because this is where a lot of our specialty hospital care is. When our hospitals become overwhelmed, then people go to those specialty hospitals for critical care. All of our children go to hospitals south of Grand Rapids or south for a specialty or critical care. So it's just a part of the big picture to look at. Region 6 and 7 are the only regions that were showing growth last week. So, we're just watching that and keeping that in mind. The others have peaked and started to come down and we're just at that little brink of, are we going up or are we going to go down? This slide is from last month, but I included it because I think it's just an important picture to keep in mind that the largest surge that we had in pediatric hospitalizations were last month. And so these have gone down the last 2 weeks, week after week, a little bit. I don't have a new updated slide on this data, but I think that's also important to know that those kids the cases went up, the hospitalizations also went up along with the adults, which is not something that we have seen at other times during the pandemic quite as sharply. So the booster dose, this slide just really talks about the Omicron variant and the importance of the booster dose. And so this was a study that looked at emergency department visits, urgent care visits, and hospitalizations, and looked at whether people had had 2 doses less than 6 months ago, or if they had had 2 doses and were more than 6 months out and were now eligible for a booster but hadn't gotten it yet, or had 2 doses and a booster. And what they found in looking at all of these visits, that protection was lowest in the middle category, where people had 2 doses, were eligible for a booster, so it had been more than 6 months since that second dose, and hadn't gotten that booster yet, and they're much less protected against both Delta and Omicron. The protection with 2 doses and a booster goes up really quite high, so that is also important in our messaging. The point of this slide is really just, it's a lot of data that points to the fact that vaccinated patients are much less likely to require a ventilator or die during hospitalization. So although the Omicron variant has been, it's hard to escape that variant, and a lot of people are getting sick that are vaccinated. Even people who are boosted, they tend to have a short course of illness and a much less severe course of illness and are very unlikely to require a ventilator or die. This is just a cumulative number that they keep tracking. It's now been a full year, 1/15/21 to 1/14/22. People who are not vaccinated represent 77.6% of cases in the past year, 85% of hospitalizations, and 83.1% of deaths. Then just looking at Omicron compared to a couple of the earlier variants, the transmissibility of Omicron is really pretty impressive. On the far right over here, you can see that the R0 is the number of people, if one person is infected with COVID, how many other people are they likely to infect? And so early in the pandemic, right here, the variants, the original form of the virus, if I were infected, I would be likely to infect 2.5 other people around me. That's how contagious that is. A little bit higher transmissibility than the flu, which is an R0 of 1 to 2. The Delta variant has an R naught of 7. And so remember, the Delta variant was known to be more contagious than the original. We were very concerned about that. It also caused a lot of severe illness, similar to polio and smallpox. One person infected is likely to infect 7 other people. Omicron is similar to the measles, which is one of our most contagious illnesses. So, you know, it is very contagious. That's the reason that it's spreading around so much. That's the reason that we're recommending beefing up on the type of mask that people are wearing. It's because it's a completely different variant with much higher transmissibility, and it's getting through some of the protective measures that we've had before, including vaccination and the masking that we've been using the whole time. So I hope that makes sense to you. I know that was one of the questions that came up earlier. These are our vaccination rates, and kudos to our staff that have worked really hard offering vaccinations for the past year and a little over a year. We were vaccinating within 24 hours of receiving our first shipment of vaccine. I know you guys all know that, and those of you who were here last year. And you can see that over on the right is this is broken down by age group, our 65 and over, broken down by county, and then total jurisdiction. Those vaccination rates are really high. If you break that down even further, 60 to 70, 70 to 80, 80 to 90, it goes higher, the older the group gets. We're still working on our kiddos. If you look at the total jurisdiction, our 5 to 11-year-olds are our lowest coverage, and 12 to 15-year-olds, and the older teens are similar to our 20 to 29-year-olds. So a little over half, a little under half in some of those groups. So this is a really important goal and strategy for the community, because the higher these vaccination rates are, the less likely this virus is going to continue to circulate among us and continue to evolve and mutate. This is just information that Munson, they always provide this graphic. So local hospitalizations and, hospitals strain. I talk to the hospitals every week. And so I know that you can look up information on the website at NDHHS. We do look that information up. We do talk with them about it. But, when they talk about being strained, sometimes it is due to the number of actual beds that they have. A lot of times recently, one of their biggest problems that hospitals across Michigan are facing are widespread staff shortages. Several hospitals downstate have federal relief teams in from the Department of Defense, the National Guard, that are in their hospitals providing care because they're so short-staffed. It is typically unvaccinated patients that are driving the hospitalization. So if we can get those vaccination rates up a little bit more, we can hopefully drive this strain on healthcare capacity down a little bit. You can see of the 83 people currently hospitalized at Munson as of today, 35 are vaccinated, 7 are boosted, just 7 out of 83. And then 48 are unvaccinated. The ICU, the number goes down. There are 5 vaccinated, none of them are boosted. And 19 are unvaccinated, most of them. And then everyone on a ventilator is unvaccinated. So we talked about the transitioning away and the pivoting. This is a statement that has been put out by all of these different national public health agencies and is moving forward in our state as well. That moving forward, we need to look at the way we're, transitioning away from some of the public health mitigation measures that we have been using all of this time, mainly being universal case investigation and contact tracing, which we've been doing since, early 2020. Unfortunately, it loses its effectiveness in the face of this widespread transmission. And so there's, a lot of people who are asymptomatic, and with the Omicron variant really have really mild symptoms. So they're most symptomatic before we get to them. There are also less people participating in case investigation and contact tracing, very few answering the phone, very few, naming contacts or anything like that. And so those, that all affects the utility and feasibility of that process. So we're pivoting away from that. And that's a really important shift. We're targeting the things on the right. So trying to work toward increasing the number of people who are up to date with their vaccinations so we can try to keep them out of the hospital and off ventilators and alive. Changing the messaging about effective mask wearing, especially when we have variants that change the transmissibility of the virus as it circulates through our communities. Targeting our prevention strategies to those who are most vulnerable. So we're working really closely with schools, with long-term care facilities, jail shelters, people in congregate settings where not only do they have more vulnerable people, but they also are uniquely vulnerable setting. We're still investigating outbreaks. We're still here to help anyone who has need for our help. And we have more capacity to help, individuals, families, businesses in the community who reach out to us, because we aren't cold calling every single person who tests positive for COVID. So I think it is a really important shift that we're making. And I think it's a good sign for the future when we're looking toward things like mask mandates as well. We are looking at, and have been looking at the criteria for when to lift the mask mandate, from the very beginning. And even most recently, I thought maybe we would be lifting it after the first of the year, and then we had that sharp uptick of Omicron, and that just wasn't the right time. So Dr. Meyerson and I talk about it every single week. COVID self-testing is important. This is an important flyer that's available to the public. We want them to know what to do if they are to test positive. Not everybody needs to hear from the health department anymore. People know what to do, as someone mentioned earlier tonight. And that's great. We're glad that they know what to do. So therapeutics are a really important part of preventing severe disease for people who are at risk for it. There are a lot of challenges with therapeutics right now, and we hope that they'll get better. So the top one, Regeneron and BAM-EDI, is how they shortened the name of that one, is been found to be no longer effective against Omicron. So it's not that it's not being promoted. It's not that anybody's holding back on it. It's that, unfortunately, it is not effective against the most prevalent strain right now. And so the supply has stopped to our local hospitals. I don't have control over that. The local hospitals don't have control over that. It is not being allocated to them, because it is not effective against the variant that's most prevalent. So Sotrovimab is the type of monoclonal antibody treatment that is available to people. Our hospitals do have Sotrovimab, but it is very limited in availability. Munson Healthcare told us that for the last 2 weeks, they got 24 doses each week. And that's all they were allocated from the feds. So there's no, I can't control that, they can't control that, and that is the truth of the matter, is they don't have it. So they are offering it to the highest tier of vulnerable people, which means elderly people who are unvaccinated, or people with underlying conditions that make them extremely immunocompromised, but they're having to turn a lot of people away. So we all hope that that supply chain lightens up and they're able to get more Sotrovimab. The Evusheld is a really unique medication. Our hospital systems do have this as well. This is for people who are immunocompromised, and it's used as pre-exposure prophylaxis. So if, like, I have a friend who's getting cancer treatment right now, is extremely immunocompromised, and he was called in to get this because he's made no antibodies, despite the fact that he's vaccinated. He's made no antibodies for the virus. And so this is actually an injection of antibodies that will protect him for 6 months. Limited availability, I think Munson had 200 doses, and I'm not sure I'm hearing how many they had last week. The antivirals are the medications. The top two are the ones that can be prescribed by a doctor. And those are early treatment. They can be prescribed by a doctor. People can take them at home. It is really a great concept. They have to be, there's a couple things that make them tricky. Number one, Paxlovid is more effective than Molnupiravir, and Paxlovid is less available. We had some of our Native American tribes have access to Paxlovid. Some of our federally qualified health centers have access to it. Some Myers stores in Michigan have access to it, although I'm not sure that any up here do. Yes.
Just curious, of all 6 of those, are any of those listed as an emergency access only, or they've been around?
Emergency use authorization.
All of them?
As far as I know, yes. Yeah, the Paxlovid is more effective than the Molnupiravir. We do have some of the Molnupiravir available at some of the Northern Michigan Myers pharmacies, and starting to be some other pharmacies. It is, it's a second choice. The things that make it trickier, people have to start taking it within 5 days of symptoms. The monoclonal antibodies are typically within 10 days of symptoms. So, if you get the sniffles and sneezes and you don't realize that you have COVID, you think it's just a cold, you might miss that for a couple of days. So people have to get in, they have to see their doctor, they have to get a prescription, and then they'll pick it up and start it within 5 days. The other thing that's a little even trickier, I think, though, and we heard this from the Grand Traverse Band, who recently told us that they have found there's a lot of drug-drug interactions with Paxlovid, and so although they have people who maybe need it and would benefit from it, they're on medications that interact with it that would be dangerous, and so they can't take it. So none of it's perfect. Hopefully it's improving. Remdesivir is a medication that's been, an antiviral medication that's been being used in the hospital setting for a long time. It is an IV administration only, and it has to be taken 3 days in a row. There's now some emerging data that are showing that it could be used on an outpatient basis, but that is also a little bit tricky as well, to have somebody come in for 3 days in a row when they're outpatient to get an infusion. So that's kind of the story as I know it on therapeutics and antivirals right now. I think it is very promising. We just definitely need to see more supply, and some of that's moving out. This is just an infographic that we share with the community. So what about the school masking order? So the school, just to review, the school masking order was issued on August 27th due to a surge in cases, strained hospital capacity. Many children were unvaccinated. Our youngest children weren't able to be vaccinated at that time. And just a really overwhelming amount of medical evidence and recommendations by key local, state, and national health providers and agencies, including the American Academy of Pediatrics, the CDC, multiple local providers who really were urging the schools to adopt masking policies. It was amended on November 9th because we have weekly meetings with our school superintendents to talk about how things are going. And, and we were having weekly meetings all through last year and through the summer as well. But before November 9th, as they were beginning to start indoor sports and performing arts, they were talking about the challenges with masking, wondered if there could be some potential for an exemption from masking during active participation. And so, Dr. Meyerson and I discussed that. We researched, we looked at what some other health departments were doing, and we ended up amending the order and including an exemption from masking during active participation if they were participating in a weekly testing program. So it's like replacing one mitigation measure with another, not just taking away a mitigation measure during a high-risk activity, really. The overall purpose has always been to protect students, school staff, and the greater community. I already talked about the medical evidence. The medical evidence continued to support masking after school started, and we started to see data. So, the case increases that we saw shortly after school started in the fall, it started to be demonstrated very clearly that we had, cases in schools, and we're seeing them right away. They went up right away as school began. And that's overall across Michigan. So one of the other things that the state looked at, U of M did a little study to look at schools who had mask mandates, schools who didn't. Like I said, it's really hard to isolate the data when you look at that county by county or school district by school district. And, we continued to watch the data. It continued to be very clear that schools with the red line, few or no mask rules, had many more cases than schools with mask requirements. And so they also had sharper increases.
Lisa, on that last slide, you can go back there for just a moment.
Yep.
It says 7-day rolling average for 5 to 18-year-old cases per 100,000. That I assume is a state number, not a Region 7 number.
Yes.
Is that correct?
Yes, it is a state number, yes.
It's, so those type of graphics are frustrating to me because, and I think I've expressed this previously, when you talk about per 100,000 enrolled population, you would have to get to 100,000. Charlotte County only has 26,000 people. You would need 4 counties the size of Charlevoix to even get to the 100,000 number. And if I'm reading that correctly, you're at roughly 80 cases per 100,000. So 80 cases
Yes.
of students throughout 4 counties the size of Charlevoix. Is that accurate? Am I reading that right?
Kind of.
Okay.
The per 100 kind of.
Mr. Chairman, can we get another point of order, please? Ms. Peacock is doing the best here she can to present this. I present information from the public every day. It's very difficult to concentrate when we have people that are interrupting, and I appreciate it. Thank you.
What I was gonna say, Scott, is just that the per 100,000 is a statistical calculation to smooth out the differences in sizes. And that is one of the challenges that we have in comparing county to county. The smaller the numbers get, the less accurate they are, because a small sample size is just in general not as reliable, and other things can affect it. So the reason that we look at state data like this is because they can isolate out some of those other factors. They're looking at cases that were confirmed by a test. They're looking at cases that were reported. They're evening out the size of those school districts by that per 100,000 population.
I understand, but it is not comparing apples to apples if you're talking about Northern Michigan versus Detroit. Or as I refer to it, anything south of Clare is Detroit. That's a joke. But it's that type of data, to me, it tends to be a little misleading. And I understand why you presented it, and it's state data, I understand that, but I don't think it's an accurate reflection of Northern Michigan.
Mhm. I think what I'm trying to do is just show you the rationale that we've used in the process that we used for, I've heard tonight that we didn't look at data, we don't share data, we don't talk about data, and we do. And this is some of the data, not all of the data, but some of the data that we've used to make the decision to keep it in place.
Okay. So I just was wondering, do you have the ability to break down this information with our own information and come up with a graph that's more suitable to our region?
I could ask the state regional
Wait,
epidemiologist.
do you have to get permission from the state?
No,
That's my question. Because you just said you're gonna ask the state, so what I wanna know is if you got the data here, you know our numbers here, are you able to create a similar graph based on our reality versus the states and come up with one, or do you have to ask their permission?
I don't have to ask their permission.
Okay. Well, you just said you have to ask the state.
What, now you cut me off.
Okay.
What I can do is I can talk to the state's regional epidemiologist who serves our area, who is the one who has the statistical programs and the access to the data to be able to isolate those other confounding factors that I talked about. So I don't have to ask the state for permission, but he has resources that I don't have at my fingertips. So I would work with him to do that assessment for you if you wanted us to.
Yes, that'd be great. I also was interested, 2 weeks ago, the guy who's in charge of at U of M, I don't remember his name and his position, but he identified himself as the physician in charge of that. And he came right out and just said 2 weeks ago that the data they're showing shows that the masks aren't effective, are not showing effective, especially in Omicron. And they acknowledge that this is the best thing that could ever happen to.
Yeah, we're getting there.
So
We're getting there.
they acknowledge that this is the best thing that ever happened because it's getting weaker and weaker, not stronger. And they identified a lot of things, which is pretty promising.
Yep.
Some of it was a little bit contradictory to what we're seeing because of really no information is perfect. But I just thought that was interesting that the same doctor is providing slides also are saying masks don't work.
So I'm going through a timeline with you. And so I'm going from when we issued the mask mandate to
Oh, I
as we
see.
watch the data come in through the fall. So this is looking at after school started before Christmas.
I do have one question. You have more slides?
Yeah.
Oh, wait,
Okay.
see if you address
Yeah,
it first.
okay, sounds good.
Lisa, just a quick question.
Yeah.
How many kids do we have in 4 counties in northern Michigan
How many kids?
in school?
Yeah, I don't have the answer to that off the top of my head.
I mean, do you have a number? Or we've had this many positive kids in Antrim County, or?
I have those, I could get you those numbers, but I don't know them off the top of my head.
Yeah, I would like to see that.
Okay, yeah, no problem. So again, this is back to school time, looking at case rate increases and this is just illustrating, and I'm just, again, showing you what we have been looking at over time to decide, does the mask mandate stay, does the mask mandate go? This is just showing that not only did the cases in kids go up right away after school started, but cases in the general population and all age groups also went up. So there's a connection there between, that's why, you know, the school mask order is intended to protect not only students, but also school staff and the general population. So what do we monitor and what is next? And this is my last slide. I'm just going to tell you that each week we look at pandemic risk indicators every week, and I report it to my staff every Monday morning. I report it to the county officials every Monday morning. Case rates, positivity, outbreaks, healthcare capacity, functioning of vital infrastructure. We also look at testing numbers. We look at the needs of the community. You've heard us talk about the mobile unit. Somebody brought that up tonight. Those are all strategies that we discuss every single week. We change them, we tweak them to meet the current community needs. We also meet with MDHHS. We meet with other state and local leaders every single week. We meet with our school superintendents every Thursday. And we make changes to our pandemic response as everything evolves. The big change that I just talked about tonight was the change related to case investigation and contact tracing. I think the next 2 to 3 weeks are key. And I don't disagree with you, Commissioner Marcus, about what you've heard about what's going to happen in the post-Omicron surge. Everything that I've shown you tonight is pointing toward the fact that this is a different time than what we have experienced before. You know, the cases went up sharply, and we seem to be starting to come back down. The hospitalizations did not go up sharply, and they in other areas are looking like they're starting to go back down. Our area still had a little increase this week, but I hope that they follow the other areas. And next week, I'm able to tell you that they went down. If deaths over the next 1 to 2 weeks don't spike up with that Omicron surge, then maybe that's time. You know, maybe that's the time. So I fully anticipate that over the next couple of weeks, we pivoted away from case investigation and contact tracing. We put that process into the hands of the public. When I talk about a risk budget and what level of risk can we live with increasing cases when hospitalizations and deaths don't surge up with it? Yes. So this is the time that we've been waiting for. You know, I think that it is a really key time that has a lot of different variables than we've seen before.
Thank you.
You're welcome.
Thanks, Lisa.
You're welcome.
That was point number 8 on our.
Mr. Chairman, I'd like to add one point. We heard before that something about every day that our mask mandate is another day that kids are doing or something like that. But I'd like to point out that every day we have our masks in place at schools, is another day that the schools stay open. And one of the biggest issues that schools face, I'm going to tell you right now, is maintaining staff and substitutes at a certain level. And most of our subs that come into our building are usually retired teachers, are often elderly, they're often in at-risk categories. And it's very, very difficult to get them to show up. We've had to close capacity one day because we didn't have enough subs. And the subs that we do get to come in are grateful and tell me they would not show up to sub if we didn't have masking in place. So I think that's something to consider. In addition to protecting the kids, we're also keeping our schools open, which I think is best for everybody. Thanks.
Yeah, Matt, I don't really disagree with that, but I think it should be up to the school. There are numerous small private schools that they don't have an issue with teachers, they don't have an issue with subs, they don't have a lot of students. And when the mask order gets lifted, I fully expect that your school is going to keep their mask mandate. Just because the mask mandate area-wide gets lifted, doesn't mean your school has to lift it. They're going to sit down, they're going to have a meeting, and they're going to look at data, and they're going to look at the report that Lisa gave, and they're going to make their decision. But one of the effects that we're starting to notice in Antrim is people can go south, and then they can start their own private school, and they don't have to abide by it. So our census from 2010 to 2020, Antrim lost population. And now we're losing population again, because the problem is when the kids leave, the parents leave, and when the parents leave, they don't come back. So it's economically challenging for a rural county that has borders where people can migrate to their choice. And so it's challenging for our county.
How long has your county been experiencing population decline?
We weren't up until this year.
I would have to say, Otsego County is similar situation, however, we're bordering another health department region, so they are sending their kids south to Crawford Osceola schools instead of Otsego County schools. So, migration and the school of choice has been a pretty easy choice.
I actually agree with you too, but his point is where I'm leaning towards, because there is a very real reality that the teachers have a voice too. And if they don't feel safe, they don't have to go to work. That's their choice, in my opinion too. But giving that student the option to stay home and go, or the parents and the school board, let them deal with that. One thing I find interesting is a little background about me. I used to own a business, had a lot of, in a very, very high recreational tourism area, hundreds every day. And even today, I live next to my business that I sold. Even today, the numbers are astronomically, the snowmobiles coming through here and snot's coming out of the people, their masks, it's terrible. It's been like that forever. But the numbers typically have going down. And I find it great that that's happening. And now I have a job that I'm traveling literally the whole region. My job is literally the whole 7 on the east side, 12 counties. And you go in every business and no one's wearing masks other than people who chose to, which I always agree on. But our numbers are going down. And thousands of people are coming up here to visit us and spend their money and recreate and do things. And our numbers are going down. This is a good sign. So I don't like the thought of wait 2 to 3 more weeks so we can read the numbers again. But they've already been told by some of the doctors that are giving you that same statistics. And the reality of the factual data is right in front of us. We still say we gotta wait 2 to 3 more weeks. I just don't agree with it. I'm sorry. I mean, it's not really I think you're looking at a trend, a graphic, but I don't think it fits with the reality of what we're seeing. So
I'll just share that I told you that we meet with our school superintendents every week. And one of the things that we talked about last week, and I've talked to them every week, I mean, like I said, I started preparing them in early December for the mask mandate potentially being lifted. One of the things that they shared last week, and there are varying opinions among that group too, not everybody agrees with each other, but the vast majority of them want just a little bit of time to be able to ramp down from it. And so, because they're going to have to deal with whatever happens then. And some of them are facing, they can't get subs, or they have staff that they're facing staff shortages too. So I think I'm trying to balance all of that as we make that decision. And so, I do the best I can with the information that I have and the education and experience that I have, along with Dr. Meyerson.
Yeah, I just in Antrim County, we have a very high population of 55 and over. There's businesses that have come before the Board of Commissioners and said, half of our employees are retiring in the next 2 years. And they actually said that may be one of the reasons why we lost a few people in the last census, was the first census we lost population. Which is why we really don't want to see people with kids leaving the county. And, when you're surrounded by areas where they can have a choice and it's important to them, that's the reality that we're up against. And I guess I've said it before, and I realize you don't have an easy situation, but I think if a school and their teachers and their substitutes want to have masks and their board wants to have it, more power to them. But there's a lot of smaller schools where they're not into it, and I've had parents email me and say, hey, we pulled our kids from school and they're not going back until the mandate gets lifted, and if it doesn't get lifted by this year, we're looking for work somewhere else. And there's a lot of federal funding and different things that are tied to population, so I like to keep that coming to Antrim County instead of.
So your census data though, Jared, is a 10-year window, it's not a 1-year window, right? So if you had a lower census this year, it doesn't necessarily mean that all those people left last year.
That's correct, but once the kids leave and the parents get a new job, why would they come back? I mean, you gotta keep them. That's all I got.
Thank you. Any further comment regarding item number 8 on our agenda? If not, we have 3 more items. Anybody want a 5-minute break? We've been here for 2 hours right now. If you want 5 minutes, I'll give you 5 minutes.
Keep going.
Let's bump it up. I'm mad. Okay, item number 9, litigation update. This is again a request from Commissioner Ruby. And I don't know, Ms. Vogler, if you want to tackle this litigation update on the Let Them Breathe in Gaylord Community, Let Them Breathe versus Health Department Northwest and Gaylord Community Schools and concerned parents of Emmett County, specifically Lisa. This is regarding associated legal representation and costs.
Yeah, I didn't intend to ask for a legal analysis, but I have constituents that ask me, okay, if we're in these lawsuits, we're hiring attorneys to come to every meeting, how much is this costing us? So, I just want a simple, I don't need a big legal document, you know what I mean?
Okay.
Commissioner Barty when she was on here, she brought before the Board of Commissioners from time to time. This is how much the health department has spent in legal fees, so.
Okay.
We have people that want to know, that's all.
It's a fair question. Ms. Peacock, do you want to respond to that? And then we'll give Ms. Vogler an opportunity to.
The reason that Ms. Vogler is here is not because of the lawsuits facing the health department. And so if you do need an analysis, if you want to understand how much of the legal fees that we've paid are due to the pending lawsuits, because it's, her presence here is not about that.
Okay.
So typically her presence here has been to advise all of you on decisions that you're making. So
Okay.
I would be happy to break down, we have all the detailed invoices. You're welcome to look at them. The finance committee has approved the payment of all of them and have had access to them, and you're welcome to come in and look at them. And we can break it down by category, but it does need to be broken down by category. And I need to understand a little bit more about what you see as defending the lawsuits versus other factors that I mentioned in my report.
Well, this was placed on the agenda when?
About a week ago.
About a week ago. I don't think we need to know the cost of legal pads and paper clips that are involved, but it would be nice to have a ballpark idea of what the health department has spent on these 2 lawsuits.
The ballpark is, I know that we had a recent approval of over $30,000. So the ballpark is over that. And I don't know, Terry, if you want to give any more detail about that.
Is Terry on the meeting?
Yeah.
Oh, okay, I'm sorry. Terry Thomas.
I don't have the detail of exclusively. We would have to actually pull the invoices and pick through them, because we do get more than one item, more than one topic on an invoice typically. So we'll have to go through them and identify what is related to this and what is related to other things. So we can do that.
Could you just email me that like in the next week or so?
I think
I
we all.
can't tell who's speaking, who's asking.
I'm a little perplexed on this, so this is an agenda item, a request from a board, and it's not being met. And I'm a little concerned over that. There's no data. We didn't get any data for this. We got excuses. So when the board asks for something, we expect to get something. Not, I only had 2 weeks. We didn't board more of a scope. Mr. Rubin had opportunity to answer questions, just like we have a chance to call you or whoever it pertains to. And he could have said more specific if somebody asked him, and no one did. So hopefully that we get a little more specific on whether or not we're gonna answer a question when the board asks for it. And two, as a commissioner, we're pretty responsible about when we call our attorney to be present at a committee meeting or any meeting, because they're expensive. And I haven't seen anything on their agenda that requires the need to have an attorney present for our meeting. And I think it's a waste of taxpayer money to have an attorney present in our meeting unless you, the chair, request it. So
Frankly, I'd be very uncomfortable taking some of the votes we've had to take since November without legal counsel present. We could have made some serious mistakes in November. We could have made some serious mistakes in December without some background information about whether what we're doing is legal or not, whether what we're doing violates state statutes. That's important, and we could cost our county and our county millions of dollars, not thousands, if we don't have competent legal counsel before we take votes on controversial issues. In fact, I won't vote on a controversial issue without a legal counsel present or being advised ahead of time. Mr. Marcus.
I agree, but we are supposed to work together, right? If we don't have enough common sense to decide whether or not there is a potential issue involved, that we need to consult our attorney, that's when you start the clock ticking and starts paying for their service.
Well,
Not just in case, okay? We are commissioners who know, and we are advised, one of us can come up with something and say, you know what, you guys, like you did earlier, this might be a problem for us, and we back down and we made the logical decision. So this is illogical to have someone there paying for them just in case. I think we need to put more little faith in ourselves too.
Well, I think when you look at the history of what's happened on this board and some.
I'm not worried about the history, we're moving forward.
Well,
right?
we are, but if we're gonna move forward, we need to have some stability here. And if we look at some of the things that were potentially expected to happen, then yeah, we need legal counsel present at this meeting. And frankly, if we're gonna break down costs and find out how much we're spending on attorneys, I'd like to know how much we've had to spend on attorneys to defend the health department from some of the actions of its own board. You know, in a situation where we're looking at terminating a contract, and we almost stepped into some things that could have cost us thousands of dollars, maybe hundreds of thousands of dollars. I'm very grateful we had legal counsel there. And I think, you know, if we're going to do these things like this, we have to have legal counsel. And if we're going to continue to attack our own staff and our own health department, our own health department, then we need to have a good idea of how much we're spending on that.
Okay, that is, Matt, you and I are getting along well, but to make the accusation that we have attacked staff is, in my opinion, an unfair statement.
Restate my statement.
Well, when I'm done, I would also state that Commissioner McGinnis has done nothing but spew hate and discontent since he resigned from this position. I appreciate the fact that you're still here. You and I probably approach the world from different political points of view, but I have appreciated the working relationship that we've had so far on the bylaws committee. And I appreciate that you are standing by your commitment to this Board of Health. But to state that this board, I said to one of my townships the other day, I'm responsible for the words that Scott Hankins speaks. I am not responsible for the words that someone else speaks. And I think it is unfair to characterize statements from this board as being attacking or as being vicious, when I don't believe that has been the case.
Okay.
Disagreement is not an attack. Disagreement is simply a disagreement.
All right, let me respond.
Go ahead, sir.
So in November, I believe it was, we had to vote on whether or not to terminate some contracts and whatnot. And that vote was, we were advised by attorneys that vote could put us in hot water, right? And so if we're gonna make votes on those kind of things, we're gonna have to have attorneys present. And if you don't want to call that an attack, you can call it what you want. But it was, in my opinion, a hostile.
Hold on. I would also point out, and I'm making an assumption for all of your counties, but when Charlevoix County meets, we have our attorney present. We always have. Because it's nice to have that legal source available. Now, I'm not saying that that is the case for everybody's county board, but I would say that that is the case for Charlevoix County. We have our civil counsel present at each meeting that we conduct. Mr. Pallarito, I think I saw your hand.
Well, I just wanted to add it, with your last statement, yes, Otsego, when there's controversial items on the agenda and perceptions that legal issues may arise or need to be discussed, yes, our attorney is invited. But we have to look at, I mean, these are dollars that could go to WIC or go to important programs, and here we are throwing them at attorneys. So I think we can take the judgment of looking at the agenda and deciding, you know, this is something that may need an attorney involved for a decision, but to invite an attorney every single time, I think we're just throwing money away.
Well, I
It's
think-
taxpayer dollars away.
Okay,
Mr.
thank
Chairman.
you. Mr. Marcus was next, Shirley, and then I'll go to you, okay?
Okay.
I do not know if it's addressed in the board rules or bylaws, but I think it's time for us to add that to the agenda for your committee to address the needs for when an attorney is present, who has authority, and by how many people on the board can override that authority.
Commissioner Marcus, have you read the booklet for the local governing entity that I sent in my packet?
No, I'm
to you
sorry.
separately?
But I know every board, when it comes to spending tax dollars.
But I
has-
also wonder if you understand the authority of the health officer as the administrative officer of the board under the public health code.
No, I
which is
don't know
different
that.
than a
authority.
county
Do you
administrator.
currently have the authority to choose when to hire a
Yes,
hiring attorney?
Yes, because you have appointed me as the
Okay.
health officer under the public health code with responsibilities
That's
under
a,
that
hey,
code.
that's a question that wasn't answered, and I appreciate it, but I don't think it's I don't think it's a very good expenditure cost.
This is one of the things that we learned.
Okay. I promise.
Hey, she spoke up, she spoke
Okay,
fact, that's okay with, okay.
Get the numbers.
Ms. Roloff.
Very curious.
It's my time. We do have an attorney. It's zoomed in here, looking at us, listening to every word that we say. Now, maybe we don't like our attorney being somewhere else. Maybe we want to really look at it and say, do we really need an attorney with us when we have our meetings? Every meeting that we have in person. Now that, to me, you can get this thing done and over with. The committee, all the commissioners should listen to Mrs. Peacock and what we have to do, but it's up to us to come back to her and say, well, we really would like to have it in person. I mean, you got one here already listening to every word that we said. So she's not here in person, but she's up there. Yeah, I've gone to a lot of meetings when, like Scott said, our attorney's there with us in our commissioners meeting. When I was on city council, her attorney was there in person, you know, and sometimes, and I don't know, we've never had one, I do not believe in person at the county, or at the,
We never had an attorney present.
We never had one, you know.
It's never been present before this board of health.
But if you
Never.
want one, you may have to get together, all and put the heads together and say, this is what we really would like.
It's not the norm for the health department. It's never been the norm. ever.
Well, then I appreciate that it hasn't been the norm in the past, but you have an entirely different board, we said at this time. I would say that
That causes us to need an attorney present?
causes us to need an attorney.
We have an entirely different board at this time, and that's the reason why we need an attorney present. Is that what you're saying?
No, no, I'm saying that,
That's what I was saying, it's not the norm.
okay, all right.
Scott,
Mr. Ruby.
on our county board of commissioners, it's been over a year now. We had controversial lawsuit related to the election. And I got asked all the time, how much does this cost?
Mhm.
And so I have to agree with Mr. Marcus that when I asked it, I thought that somebody was gonna have the numbers here.
I'll give you the numbers, Jairus. Do you just want the total?
Yeah,
I'll look them up and I'll give them to you.
well, Karen had it broke down, but if you want to just give them all in one, that's fine too.
Yeah.
But it should have been here tonight.
It was an agenda item that was brought up. It was placed on the agenda, as Commissioner Rubin stated at least a week ago. And it is, I would agree with Mr. Marcus and Mr. Rubin that that's a question that should have been addressed tonight. But I would like it to be placed on the agenda for our next meeting so that we can have that specific data.
That's a good question.
Yes.
These are recorded, right? For
Yeah.
minutes, that we get proper minutes taken. So if we needed, if something's said in a meeting to where a red flag goes up, don't we have the ability to provide the video, the audio, whatever we use to their attorney for them to review?
Yes.
Which could be zeroed down to a particular area, which we, because they charge us by what, 15 minutes or 15 seconds, I believe it is. I'm honest, I'm serious, every 15 seconds, am I wrong?
Within 15 minutes.
Yeah.
15 quarters.
So it feels like every second, but I'm trying to be prudent and conservative with money. This has nothing to do with opinion. This has to do with money. And I believe that there's a fiscal way to do things and do it right and still have the oversight and protection for us not making stupid mistakes. Right. And I believe that we could use that attorney in that type of capacity when somebody feels there's a red flag, that we could just hire them to provide them that data for that 1 5-minute segment. That's all I ask.
I think we had counsel in November that told us that probably the most fiscally conservative and responsible thing to do would be to support our own health department and move forward with that. And we're likely to.
Okay.
That's what I heard from November.
I appreciate that. I would also go on record as stating that I think every board member here supports our health department. We have stated publicly in meetings that we appreciate the work that's being done by our health department. I specifically gave kudos to Ms. Thompson for delivery of over 50,000 vaccines. I know that specific number. And to say that we don't support the health department is misleading. If we disagree with something that the leadership is doing, then that's a disagreement, but that's what we get elected to do. So I think that's a misleading statement.
It's also misleading, I believe, to imply that you don't have access to the budgetary information that you need. You were sitting right next to a member of the finance committee who just approved the bills last month. And you have access to that information through that finance committee every single month. One of your biggest responsibilities is to approve our budget, which you did in September. And so I think it is also misleading to say that you don't have access to the health department's financial information.
All I asked for was a summary.
Thank you, right?
Okay.
Can you please call to order, Chair?
I'm going to move on to item number 10, which is Ms. Moore here.
No, she
Okay.
had an emergency.
She's not going to be here at all tonight. Okay.
She requested that she could give a little update at our next meeting.
Okay.
So.
All right.
I would
Moving past item number 10 then to item number to committee reports. So Personnel and Finance Committee, accounts payable,
That would be me,
Ms. Roloff.
yes. I'll make a motion that the finance committee met and recommends approval of the January bills in the amount of $7,053,000, $548.98. Everybody get that?
I think what you meant to state, Shirley, was 753,000.
That's what I heard.
When I said 100, then
$548,090.
I kind of said it, I thought, oh, I said that one. Okay, and then January employee expenses of $12,860.66.
Motion on the floor, is there a second?
I'll second that.
Seconded by Commissioner Pallarito. Because we're spending money, we need to have a voice vote. Jen?
Rubing,
No.
Marcus,
Yes.
Rolla,
Yes.
Hankins,
Yes.
Coons,
Yes.
Valerito,
Yes.
Brown.
Yes.
Thank you. And then, Mr. Rubin, you want to give an update on the revision of the bylaws?
Yeah, so we met. Yeah, anyway, we're going through our bylaws and we discussed quorum. And we discussed whether we wanted 3 counties or 4 counties, and I'm still thinking about that in my mind. Makes me rethink about it now that McKinnis resigned. And I guess we'll probably bring that up again at the next one.
Which I think we're scheduled for, is it next week to meet again? Matt, you remember the date?
Yeah.
The eighth.
The eighth,
Tuesday, I think.
the eighth. Yeah, week from tonight, we're gonna be meeting again.
Quick reminder on that, we asked Board of Health members to submit recommendations for rule changes for the meeting rules. And if we're prepared at that meeting, that will be helpful.
Correct.
So anybody who wants to make changes can send it to one of the members of the committee. That makes sense?
Yes.
Yeah.
Anything further, any further discussion? Okay, under unfinished business, typically when Charlotte County winds up a meeting, we kind of go around and speak to each of the commissioners present. If anybody has any specific issues that you want to discuss, I don't want an hour and a half presentation, but I guess it'd be good if we got an opportunity to go around. And I'm gonna start with,
Just a quick question, Mr. Chair, is this on the change on the agenda?
I guess that would be, we hadn't voted on that, so
We can
Good
make a
point.
motion to
good point.
add it to.
I didn't know what you were talking about, to be honest with you. You were just talking about just updates in the community area.
Well, no, if there was anything specifically on your mind regarding the Board of Health. But I think Mr. Coons has a valid point that would be an amendment to our agenda, and I don't know what we need to do so now. Is there any other unfinished business that needs to be discussed by this board? Going once? Hearing nothing, I will take a motion for adjournment.
I'll make that motion.
Moved by Commissioner Roloff, is there a second?
A second.
Mr. Pallarito, all in favor, say aye. We are adjourned, thank you. Thanks.
Thank you.
We got,
Oh, trying to steal the good.
trying to.
There was a copy of the agenda. Someone was
Yeah.